books is in. The books are in. Yep. They in. They're here.
Log in to KofiPaisaTV.com and get Spears of the Mossy Volume 1 by Kofi Paisa Research Team, from Spears the Pen Volume 2 by Kofi Paisa Research Team, Spiritual Combat Volume 3 by Kofi Paisa Research Team, One Night Before Bed by Any Harek Shawn Calfunny, Kalawa's Trip to the Motherland by Kofi Paisa, From Cocaine to Consciousness by Any Harek Shawn Calfunny, As I Learned, We All Learn by Kofi Paisa. Also, if you want fresh merch, go to our online store, Family Connect Apparel, and get all the brands. Also, get our 54 deck of quiz and educational cards available now on KofiPaisaTV.com.
ETM Hotel, Rennie Shawn. Welcome in peace. My name is Shawn. I'd like to thank everybody for tuning in to Science with Shawn this evening. And for those who will catch the replay, I appreciate you catching the replay. Please like and share the show. If you're not subscribed to the Mossy Warrior Clan, subscribe to our YouTube channel. We do a lot of things from an African perspective, an African-American perspective, a cultural perspective. We deal with the customs and the traditions of our ancestors and our brothers and sisters currently on the continent. We also deal with science, methodology, history, and so forth. We have a unique front line of Mossy Warrior Clan members. All have published works, maybe two that do not have, are currently not working on any published information, but the rest of the team has some type of information either in journals, written articles, and or book publications. Also, anything that I discussed today will be in the description of the video. We will deal with that, and we're going to have a nice little conversation regarding some stuff at the end. So without further ado, I do appreciate those of you who are showing up. Peace, Sister Tika, Cedric, Rico, what's good, bro? Sister Benita, I see you in the chat. To the onlookers who really don't comment in the chat, peace to you. Please again, like the show, share the show. I know people was expecting or anticipating me to go in a different direction today. I wanted to do that, but something told me I need to go ahead and do the Science with Shawn this evening. So I want to kind of get in the way of that and deal with it from that perspective. And tomorrow afternoon, I will be presenting some other information that will be, it could be very controversial, and we're going to tackle that matter at hand. I'm just waiting on a few more people to get in, and then we're going to get to rocking. If you missed last night's show, please go and check out last night's show. It's called Simbi, and it's dealing with the Congo. And, you know, we're rocking it out like that. I don't want to give it all away, but, you know, that was a nice conversation last night. And I think a lot of people could actually learn from that. And hopefully, you know, you are learning from some of those things. So it's a nice little brief build. It wasn't very long. It's more so around like 30 minutes or so. The additional 15 is just some talking and stuff like that in between. But yeah, please go ahead and do that. So I am going to go ahead and get started because I don't want to hold everybody up And then on the tail end of this particular bill, we'll be learning a little bit more about science. All right, so I see you, Brother Rico said we're ready for the info. Peace from West Africa. Peace, Sister Althea. Peace to you. And then everybody that's coming in, you know what I'm saying? Again, it'll be any source I use will be in the description. So before, I get started, I always want to go ahead and put the disclaimer on deck because I don't want any video pauses or whatnot in our stuff. So the copyright disclaimer as follows: the copyright disclaimer under Section 107 of the Copyright Act of 1976. Allowance is made for fair use for purposes such as criticisms, comment, news reporting, teaching, scholarship, education, and research. Fair use is use permitted by copyright statute that might otherwise be infringing. All right, so without further ado, we're going to go ahead and get into our bill. I'm going to leave my screen sharing, expand my screen here, and let's see what we can learn today. All right, so SARS-CoV. This article here is from Pediatric Research by Nature. In February, on the 24th of February of this year, this article was published. SARS-CoV-2 vaccine testing and trials in the pediatric population, biologic, ethical research and implementation challenges. So we're going to deal with the actual challenges and then we're going to progress. So in the abstract, it states, as the nations implement SARS-CoV-2 vaccination in adults on an unprecedented scale, it is now essential to focus on the prospect of SARS-CoV-2 vaccinations in pediatric populations. To date, no children younger than 12 years have been enrolled in any clinical trial. Key challenges and knowledge gaps that must be addressed include rationale for vaccines in children, possible effects in immune maturation during childhood, ethical concerns, unique needs of children with developmental disorders and chronic conditions, health inequities, and vaccine hesitancy. Because COVID-19 is minimally symptomatic in the vast majority of children, a higher acceptable risk threshold is required when evaluating pediatric clinical trials. Profound differences in innate and adaptive immunity during childhood and adolescence are known to affect vaccine responsiveness for a variety of childhood diseases. So COVID-19 and the accompanying social disruptions, such as the school shutdowns, have been disproportionately damaging to minority and low-income children. In this commentary, we briefly address each of these key issues, specific research gaps, and suggested broader learning health system approach to accelerate testing and clinical trial development and ethical and effective strategy to implement a pediatric SARS-CoV-2 vaccine as rapidly and safely as possible. So they deal with the impacts. The impacts are everything that was listed previously, but a little bit more generalized as far as the school shutdowns, how the response would be in children, would it affect maturation, who is it affecting the most, minority and low-income children, of course, and then there'll be phases. Now, this is the first conversation published by the Journal of Nature and going through the rationale of dealing with pediatric population. All right. Now, I'm not going to read the entirety of this particular article. I did put it in the description for people to learn from. I do want to hit you off with just basically a little brief summary. I feel like this information is very useful. It's a starting point. It tells us where we're going in the direction and what the expectations are for pediatric trials. Okay. Dealing with a novel virus, and children are affected with COVID-19. All right. Now, moving on. I'm gonna play this 4-minute article about Moderna beginning their enrollment in children as we progress from collecting data. I'm showing you something here. We are collecting data, right? We're collecting data and we're setting the format for what needs to come. SARS-CoV-2 vaccine testing and trials in the pediatric population, biologic, ethical research, and implementation challenges. So here we set out, right? This article, the Nature set out to address key points. We just talked about those points of concern. There were 6 points of concern, right? All right here. Now that we know the points of concern, enrollment for trials began.
And now, this message comes from NPR sponsor Key, a bank devoted to helping clients shape the future of healthcare. Helpful information about healthcare trends impacting your business is available at key.com/healthcare trends.
The U.S. has administered more than 110 million doses of COVID-19 vaccines, but the vast majority of those jabs are going to adults. Pfizer's vaccine is authorized for people as young as 16. The vaccines from Moderna and Johnson & Johnson are for people 18 and up. So are these vaccines safe and effective for children? Pfizer is currently testing its vaccine on teens who are 12 to 15 years old. And just yesterday, Moderna announced that it has begun enrolling children as young as 6 months into a trial of its own. Dr. Steve Plimpton is an OBGYN in Arizona, and he's the principal investigator for that Moderna trial in kids in Phoenix. Doctor, what kind of response are you seeing to the calls to join this trial? Are parents excited to enroll their children?
Good morning. Thanks for having me. Yeah, they're very excited. The response from the parents has been overwhelming. They seem very ready. They're calling literally all day long, asking for when they can get their kids vaccinated.
What are they hoping to get when they make these calls to you? What are they hoping to come out of this for their kids?
They're looking for protection for their kids especially here in Arizona. The kids are going back to school by governor mandate, and now we're going to have more exposure issues for these kids. So in essence, I think that the parents are looking at protecting their kids, but indirectly, they're also going to be protecting themselves and those around the kids that might be infected if the kids actually get infected.
Yeah, especially grandma and grandpa. Moderna is the first vaccine maker in the country to enroll infants. How are the protocols for children this young different from the adult trials?
We're giving different doses for the kids. They'll be graduated doses because we need to also determine the dose that's most effective for the kids. So it starts out with a smaller dose. It's still the same 2 injection as the adults get, but different doses. And then blood work will be done on the kids to determine how they respond so we can determine the right dose for the children.
How quickly after the doses does the blood work happen?
There's blood work on the day of injection, and there's blood work at a month past the injection, and then 5 months down to find out how they respond.
Okay, now Pfizer began enrolling children in its COVID vaccine trial back in October. Clearly, these trials take a lot of time. Any idea how long before we have data from Moderna?
Well, the study is projected to go for 14 months. I don't believe that it'll take that long with the response. We already have 300 parents here in Phoenix that want to get their children injected. So to achieve the 6,750 patients we want for statistical significance in order to get the data to go to the FDA, it'll probably be less than that amount of time.
Wow, that's pretty quick. Now, if these vaccines are safe and they work in children just as they do in adults, I mean, how significant, doctor, of a game changer would that be for reopening schools?
Well, we're reopening the schools. The game changer here is more for protecting the kids who don't really get sick with the COVID-19 infection. But as you alluded to, the indirect and the tangent we're going to get on this is protecting others around. We're going to head more towards a community immunity and then obviously onto herd immunity by taking this population out of the potential transmission of COVID-19.
Would all of the same things for adults after their 2 doses apply for children? Would they have to wait 2 weeks and then not maybe wear masks, or do all the same rules and protocols still apply?
Well, that's what we'll find out.
Okay. Now, young kids, I mean, they're not as likely to get too sick from coronavirus, but they can spread it. We know that. What does an effective vaccine for children mean for community transmission as a whole?
Definitely a reduction, because these are obviously kids, prior to being able to talk and walk, that can transmit the virus. So if we can take out this segment of the population, it'll be another step closer to actually, like I say, achieving herd immunity and protecting everybody.
So are we talking play dates? Are those back on the calendar for parents? Because I think parents would love to have play dates for their kids.
We're all starved for any social interaction for our kids, if not for ourselves. So this is a step getting back to our normal life.
And I guess the doctor too, the other thing, the business side of this would be businesses, say amusement parks, where, that's where kids, I'm sure, would love to go and maybe haven't had the opportunity in a long time. Is that something that maybe can open up wider when kids get vaccinated?
Oh, I'm sure. And ultimately, we're kind of seeing that happen. And like with cruise lines requiring everybody going on a cruise to have vaccinations done. So initially, they're not going to allow kids to go on cruises, but this is going to open up a whole nother spectrum of our lives that we haven't seen for over a year. You know, being able to participate in all those fun activities without worrying about it.
That's Dr. Steve Plimpton, the principal investigator for that Moderna trial in kids in Phoenix. Doctor, thank you.
No, thank you.
All right, so we just got that information from the doctor. Vanderbilt Children's Hospital are moving forward with the beginning of their vaccine trials. So there will be here in my city a trial regarding children that will be a part of the trial and getting the vaccine and handling their business from that nature. Also, long haulers are seeing relief from being vaccinated. They are they're calling it mysterious relief, which is the vaccines are helping some COVID long haulers. So there's some additional benefit there. Moving forward with the children and the vaccine, we have a chemical and engineering news article. This article is referring to both Moderna and Pfizer. They're talking about the COVID-19 vaccine trials for kids and how they are ramping up. This process is moving right along. The article before this was the 17th. This is the 18th. So I'm trying to show you some type of method and how all of this transpired. Now, in the core of this, and we're going to deal with this a little later, it's talking about all three vaccines that we know that did 18 and up. All right. Now you have Pfizer, they're doing 12 to 15. And then you have Moderna that's doing 12 to 17. And then they have some pediatric stuff that they're launching to run simultaneously to do pretty much a phase 2 and phase 3 trial simultaneously. Why they weren't running these trials concurrently? Because they already have the data from a wider population in the rest of the population, so to say, and that allows them the ability to know what's going to happen because they've already been running them 18-year-olds, and then when you step back to 17-year-olds, and when you step back to 16-year-olds, some people are vaccinating 16-year-olds right now. You're seeing that. You're seeing positive results, or are we? So this article is basically stating that these three companies are gearing up to trial certain demographic of the pediatric community. And I didn't want to read that to you. I just want to kind of get you going in that direction. And then we have the live science article, which was done 15 days ago, which basically states the same thing about the Moderna starts COVID-19 vaccine trials in infants and young children. This is basically repeating itself from everything else that we had going on. And now you can go to clinicaltrials.gov to actually get the clinical trials data on the mRNA 1273 results. Later, we should be getting those results. As you can see here, they're doing follow-ups all the way to 2022 with these children that will be involved in these results. And we will have immediate data that'll come out of those results after about a couple of months regarding the responses from that. Because remember, this is Moderna and Pfizer are 2-shot vaccines. They will get administered their first vaccine. 3 weeks later, they'll get their second vaccine. And then, they'll be out in the population or whatever. They'll do their follow-ups and everything that they need to follow up with for people. And then we'll have the actual data. Now, this data will be substantial because this is moving toward a complete authorization, full authorization for these vaccine companies. So these companies' ability to be able to have successful trials in this population would shed light on these vaccines being approved for full use. And then, people being able to go wherever they're going and get the vaccine instead of it being currently under EUA, emergency use authorization. Now, so far, so good on the 16th. This is basically Moderna when they did the announcement on the 16th. and they told us specifically what age demographic they are targeting and why. And then they go into some other information about the vaccine trials and where they have already published additional data. That's why you see a bunch of New England Journal of Medicine all throughout here, right? Okay, now with Pfizer, I'm gonna flip the switch. They did Moderna. March 31st. Response is 6:45 a.m. What's today's date? March 31st. It is 9:22 a.m. Central, 10:22 Eastern, Pacific. What is it? 8:22 or something like that. 7:22. Yeah, 8:22, I think. So here we go. I'm gonna skip this first part, and then it gives us the about phase 3 data from 12 to 5. They enrolled 2,260 people between the ages of 12 and 15 years of age. In the trial, 18 cases of COVID-19 was observed in the placebo group. There was 1,129 of them in the placebo group versus none in the vaccinated group. Out of 1,131 people in the vaccinated group, none caught COVID. Vaccinations with the BioNTech 16-2B2 elicited SARS-CoV-2 neutralizing antibody geometric mean to tiers of 1,239.5, demonstrating strong immunogenicity in subset of adolescents 1 month after the second dose. This compares well, was non-inferior to GMTs elicited by participants from 16 to 25 years old, which was 705.1 GMTs. In the earlier analysis, further BNT 16-2B2 administration, that is the vaccine name. For anyone who's first time listening, this is the vaccine's name. Administration was well tolerated, with side effects generally consistent with those observed in the 16 to 25 years of age group. All right, so the companies plan to submit these data to the FDA and the EMA for request amendment to the emergency use of the BNT 1262B2 and an EU conditional marketing authorization for Comirnaty to expand the use in adolescents. So they will be filing soon to expand the use in adolescents. And you can bet that Moderna will be right behind them, and then Johnson & Johnson. Okay? Once they file, we will have more results that will give us, like we looked at the data with the trial back in last year, the end of last year. We will reconvene a follow-up to this particular video with that EUA data. All right? Once we get the authorized use, we will have the data. All right. So we will see what actually happened with these 12 to 15-year-olds. And then we will see what happened in the pediatric level. We already know that pregnant women are getting, are transferring antibodies to the baby. So we're covering it there. What we are doing is we are fighting an invisible fight to achieve herd immunity as fast as possible so that we can get back to doing what we like to do, and that's travel, that's hang out at bars, football games, basketball stadiums, whatever we do. We want to do what we do. Let me see here. Now, in the clinical studies, adverse reactions in participants 16 years of age and older included pain at the injection site, 84% fatigue, 62 headache, 55 muscle pain, 38 chills, 31 joint pain, 23 fever, 14 injection site swelling, 10% injection site redness, 9% nausea, 1% malice, 0.5, and the lymph node issue where you get some swelling in the lymph node area, that was a 0.3%. Severe allergic reactions, including anaphylaxis, have been reported following the Pfizer-BioNTech COVID-19 vaccine during mass vaccination outside of clinical trials, which is what we would normally see in the realm of the population. My brother, he had got the Johnson & Johnson, one shot. He was fine when he got it. We went home. He said his arm was a little sore, but the next day he was pretty much tired, fatigued, and he had some muscle soreness. And he was down. He got out, got his hair cut, came back home, got in the bed, went to sleep. When I called him to check on him, I woke him up. He had told me, what he was dealing with. He felt a particular way, but he said he was in for the rest of the day. I called him the next day, early in the morning. Asked him how he feel. He said, "I'm good. I'm moving around. I'm good. I was just down for that little hot little one day. I'm right back at it." Today, I talked to my manager. My manager got his second shot yesterday. Yesterday. He didn't really work too much yesterday. He said it wasn't because of the shot. Is at the time he actually got it, he really didn't feel anything immediately, but the next day he was down. He worked today. He was a little, you could tell he was a little tired. He said, "I'm glad I got it." He said, they say it make you feel like you actually got COVID or some of the symptoms. And he was like, but other than that, I'm waving it. I'm on the back side of it. I'm just rest. And I just need to lay down and stuff like that. But tonight he was online before I got off. He told me he's feeling a lot better than he did earlier in the day. He's been eating he was eating, and he felt like he was just a little dehydrated and needed to drink something. So that goes back to what Concrete Corey said about being hydrated. So before I get my next shot, of course, I drink a gallon of water a day. I'm going to keep up that method. So going into that vaccine, I'm going to make sure that I'm hydrated before. And then when I come home, I'm going to continue to hydrate. And then I'm going to just get some rest, because I know I'm expecting or anticipating a down Friday for me when I get mine on the 14th. I had to move mine from the 9th to the 14th because of my off days. And I probably should have moved that to the 13th so that I can be out, 13th and 14th. However, let's move forward. Today, more news regarding Pfizer BioNTech backed by CNN, the CNN article. I'm going to just give you 2 minutes of Dr. Hotez on Pfizer's report. All right, hold on 1 minute while I take a minute to pull up. Excuse the commercial. All right, let's see. Should be good.
Remember, these vaccines have not been approved yet in the United States. Everything's been done through emergency use authorization. So at some point, Pfizer's got to file what's called a BLA, a biologics license application. And they've got to decide, are they going to include adolescents? Most likely they will. So that may be the mechanism by which it happens. I think there is some urgency to try to do this by the fall. And so I think over the summer, I wouldn't be surprised if we start seeing adolescents get vaccinated.
And we should say VRBPAC is a FDA commission. That's a necessary hurdle for this to go to the public. I've got 100% efficacy. In your experience, how common is that?
Well, as a pediatric scientist, we've always thought of the best vaccine that we have is measles, which 2 doses gives you 97% protection. So it's pretty impressive. Now, on the other hand, it's 1,200 individuals, and undoubtedly, as you get to larger groups, we're talking about millions of individuals, probably the 100% won't hold up. But, given the level of virus neutralizing antibodies that we're seeing in adolescents, it's going to be a pretty damn good vaccine.
And so if it works this well for adolescents, does it stand to reason that it would for kids under 12?
I think so. And that'll take a little longer because safety studies always take a bit longer in the younger kids, although we'll start doing clinical trials. What may hold up the pace of the clinical trials in the younger kids is that we've been seeing this syndrome caused by COVID called MISC, multi-system inflammatory syndrome of children, which may have partly autoimmune basis. In other words, it's a delayed reaction to the virus that causes it, and probably due to the host immune response, maybe due to antibodies. So I think that fact will probably slow people down in terms of how quickly we go to vaccinating little kids and watching for that.
All right, so there we go on that tip. Now, with that being said, let's get into the meat and potatoes of the show. We got a little update. Like I said, we'll reconvene on where the children are with the vaccines. Make sure you got your pen, paper, and ready to answer these questions because I guarantee you should know some of these answers. All right.
Welcome back, everyone. This is lecture number 19. We are going to talk about vaccines. Vaccines are our proven best defense against viruses. And they work by mobilizing our immune system to prevent infection. They give us memory, so they immobilize.
I'm gonna let him say this to you one more time. I hope y'all heard him, because he didn't take long to kill all the noise.
Welcome back, everyone. This is lecture number 19. We are going to talk about vaccines. Vaccines are our proven best defense against viruses. And they work by mobilizing our immune system to prevent infection. They give us memory, so they immobilize the adaptive immune response. And as you will see, they break the chain of transmission. For the most part, they do not prevent infection, but they do prevent disease and death. And vaccines are one of the reasons why our life expectancy has increased steadily since, well, on this graph, the 1900s, but even before that. You know, if you were born in 1900, you could live maybe 45, 50 years the most, and now 70 plus years. Vaccines, medicines, public health measures, sewers and toilets, all of those had played a role. And this is a dip in 1918, which is, of course, the consequence of the 1918 flu pandemic. And I'm wondering, I'm sure we'll have a dip in life expectancy as a consequence of the COVID pandemic. What vaccines do is they stimulate a protective immune response. Here's a slide we have seen before, where we're looking at either antibodies or T cells with time after your first infection, and then later when you reinfected. So at your first infection, you have an initial immune response, which comprises antibodies and T cells, which peaks in a week or two. And then after infection, the titers decline to a low level, not zero, but very low in the blood in terms of antibodies and in tissues for T cells. And then, of course, when you are infected years later, you have memory, so you can respond much more quickly, more specifically, and with higher affinity. So you store memory B and T cells that can respond quickly, but they don't respond immediately. It takes a few days. And so even if you're immune, you will still get infected. But the antibodies and T cells will limit the infection, they will limit transmission, and they will limit death and disease, or I should say disease and death. That's how they work. And, you know, the whole dialogue around the COVID vaccines, are they going to prevent transmission? Yes, that's how vaccines work. They're not going to prevent infection. And you'll see more of that today. First vaccine developed by Jenner in 1796 against smallpox. He observed that milkmaids never got smallpox. He worked in the UK. They got cowpox pustules instead. It didn't kill them. He took the cowpox pustules and he scraped them into the skin of a young boy. And then 2 weeks later, he challenged the boy with pustules of smallpox. And that boy was protected. Good thing he waited 2 weeks, right? And not like 4 days. Would have killed the boy. And now That led to the development of the smallpox vaccine, which eradicated smallpox from the globe. Today, the vaccine is scraped into the outer layers of skin with this bifurcated needle. It has a drop of vaccine in it. It's still used for the military and other individuals. Pasteur made the next vaccine a rabies vaccine in 1885. He called it vaccine after cow, the Latin for cow in honor of Jenner. And then subsequently, yellow fever and influenza vaccines were developed in the 1930s. How do we determine which vaccine will have a longer immunological memory? Pretty much empirically. We test vaccines to prevent disease and death, and then we see how long they last. And it turns out some of them are not so good. Some of the flu vaccines don't have great memory. We have to fix it. Now, shortly after Jenner's vaccine, the anti-vaxxers arose. And here's a print of the wonderful effects of the new inoculation from the Anti-Vaccine Society. In Jenner's time already, they thought, if you take this vaccine, you're going to get cow parts growing out of your skin. The anti-vaxxers have always been with us, and they will never go away, unfortunately. We have now used large-scale vaccination campaigns to reduce many infectious diseases. These are done on massive scale. Here's the polio campaign, which has nearly eradicated polio globally, as you'll see in a bit. Measles vaccine has nearly eradicated measles where it's used, but of course there are people who don't use it, anti-vaxxers, so we still have measles. Here on the right is a graph of the lives saved by measles vaccination over the years. Here would be the deaths in the absence and the deaths in the present. So millions of deaths averted. These are good things to be using. Vaccines are now an integral part of our existence. We immunize children, of course. We immunize adults, even old folks, with shingles vaccine. We immunize our pets, and we immunize farm animals, chickens, pigs. We even immunize fish. We even immunize wild animals to prevent rabies. We drop bait from helicopters into the forest, and the bait is laced with rabies vaccine. It actually cuts down on wild rabies, and that's where it goes into the dogs typically. Many childhood diseases are now rare, and vaccines have become a major part of Western nations' public health measures. The first thing we thought about as soon as COVID arose. However, developing nations, as you know, they do not vaccinate efficiently, and therefore there are outbreaks of diseases, rubella and measles. Now, vaccines work by inducing population level immunity, herd immunity, this is called. Unfortunate name, but that's what we're stuck with. And it means you have to maintain a critical level of immunity in the population. What does it mean? So we have here in the lower left, all these people who are colored black. They're not immune, so they can be infected if someone is shedding virus. If you're now vaccinated or immune in some way, you're green here. The red infected person cannot transmit to them, so the people who are not immunized are indirectly protected because transmission is cut down in the population. And on the right, everyone is immune, but that's not always the case. It's not always the case that we can immunize everyone. We don't have to. So herd immunity is about stopping spread when the probability of infection drops below a threshold. The threshold is virus and population specific, and it depends in part on the R0. As we discussed earlier, that's the average number of people who are infected by an infected person.
I want to pause this right here because I heard that let me be specific. I heard that someone may misinterpret data, possibly, or didn't have a command or understanding for this particular slide that I have up called herd immunity. And herd immunity is important because this would be a reason why we wouldn't need a mandate for vaccinations. And I'll just say that and move on. And how you get to herd immunity, of course, you have to have a certain amount of the population vaccinated. right? But in the early, like as an example, during smallpox, they didn't know about virus mutation. They don't know what we know today, right? They just really figured out how to treat smallpox, right? Because the information that they got from Onesimus. But they didn't know that smallpox could mutate, adapt, and mutate. And there's different variants. Like you don't hear about the different smallpox variants. So certain precautionary terms was had. Yeah, I'm not defending or saying it wasn't. But I'm just saying, in order to achieve herd immunity, it took 80 to 85% of the population. Measles, 93 to 95% of the population. Remember, smallpox was popping people left and right, but they had to vaccinate 85% of the people. So you go and you look at the United States population at the time of smallpox outbreak, and then you see that they had to vaccinate at least 85% of that. You're going to have an understanding that a small portion, 15% of the people who probably ended up getting vaccinated, but not at the actual time, wouldn't necessarily be us per se. As you can see here, no vaccine is 100% effective. And this is why you have people like, there was a teacher who has had both doses and still tested positive for COVID-19. You had a mother test positive for COVID-19. We also saw that in 20 people in the vaccine trials that they're not creating any antibodies. So there's still scientific research being done on why these people are not creating antibodies and what will be a safer solution. We know this already because no vaccine is 100% effective.
And so the fraction of the population you need to be immune to stop smallpox is between 80 and 85%. Measles, 93 and 95%. Very high because the R naught is high. Complicating this is the fact that no vaccine is 100% effective. Not everybody makes an immune response. Article in the New York Times today. Some people will get infected after vaccination. Really, that's an article? If we have 90% efficacy, those 10%, of course, they're going to get disease. I don't understand why that's news. And when you immunize, for example, 80% of the population with a measles vaccine, only 76% are actually immune. So 4% do not respond to the vaccine. That's just human genetic variation. So here's the number for SARS-CoV-2. The R naught is 2 to 3. So the number of people who must be vaccinated to prevent spread is 1 minus 1 over the R naught, 50 to 70%. We can do that. We're approaching it in many places. Israel has already exceeded it. Remember, even though we've reached herd immunity, they're going to.
Israel has exceeded 70%. They have like 90-something% of their population vaccinated. I think the rest of the people that are not vaccinated are the Palestinians that are in Israel. Of course, we know there's some internal conflict, so therefore we should expect some type of discrepancies there.
To be people who are not immune, and the virus will find them at some point. So there will be infections. Remember that R naught is a formula that includes virus characteristics like duration of infectivity, but also human characteristics like average duration of contact between the infected and uninfected hosts. That's very hard to determine. So if you tell me that the R naught of some variant has gone up, I don't believe you because you haven't ruled out the human factor, which is always the case when there are outbreaks. We're going to achieve herd immunity, and that's, I think, already causing the outbreak to subside. Now, the problem with vaccination, we can make vaccines, as you saw, very quickly, but there's vaccine hesitancy, which is a danger to any vaccination program. You know, the ability of a program to succeed is based on these three factors: trust of people in the vaccine, confidence, complacency, perception that the risks are low and vaccines are not necessary, and convenience. can you get people to go get it? It's not easy for working people to go often. And many people are not even convinced that COVID-19 is worth getting vaccinated. We need to have informational programs as well. Anyway, these are some of the things people say as reasons for not getting vaccinated. Kids should get infected naturally. Really? With the possibility that they die or have debilitation? It's ridiculous. I can't afford to immunize my kids. Well, that may be an issue. It should be free. In fact, in many countries, it is free. It should be free in the US. I don't see why it's not. In some cases, you can have a medical exemption to vaccination, but they should not exceed 1% of the population. In some places in Texas, the medical exemptions are 50% because you go to your doc, I don't want my kid vaccinated. They give you a medical exemption, and they shouldn't be. And if they don't, they lose their patients. It's horrible. There are also religious exemptions, which should not be allowed at all, in my view. Many states are outlawing them. It's just another excuse not to be vaccinated.
Say that again one more time, Vince.
And they shouldn't be. And if they don't, they lose their patients. It's horrible. There are also religious exemptions, which should not be allowed at all, in my view. Many states are outlawing them. It's just another excuse not to be vaccinated. Anyway, we had a few docs on TWIV 496 to talk all about this, as well as autism and so forth. Worth listening to. So in the end, vaccine programs depend on public acceptance of their value. And these people who are anti-vax often congregate in communities of some kind, often religious communities. So for example, this is old because this outbreak was a while ago, 58 cases in Brooklyn, all unvaccinated members of an Orthodox Jewish community in Brooklyn. The rabbi said, don't take the vaccine. You should be naturally infected. What does a rabbi know about vaccines and infectious diseases? They listen to their leader and they get infected. Here, Hare Krishna community in North Carolina.
Oh, let me pause it. Now, y'all remember us saying this a few years ago, right before the debate, that dude said that, and the state, New York, made them get vaccinated. And so when Unc went in there to argue with them people, this is what he was dealing with primarily. You know what I'm saying? You got people who are unscientific telling other people who are followers by faith what to do, and then it led to an outbreak. But let Vince build.
A church in Texas was critical of measles vaccination. I would like to talk to the leader of that church and say, what do you know about vaccines and epidemiology and disease? So he tells his congregation to not get vaccinated and they get sick. It's totally crazy. This drives me nuts. Anyway, there are outbreaks all over the country like this, and that's why we have measles throughout the years in the US still. There was a big outbreak in Westchester last year. Same thing, Orthodox Jewish community. The rabbi said, don't get vaccinated. Those of you going to be doctors, you're going to have to deal with this. You better tell people to get vaccinated. Don't give them a medical exemption unless they need it. Like if they're immunosuppressed and so forth, they may get a medical exemption. Let's have a quiz here. All right, herd immunity. A, demonstrates the importance of...
I ain't going to let him read it. I got it big on the screen, but I'm going to read it to y'all. Herd immunity. A, demonstrates the importance of immunizing livestock. B, emphasizes that not everyone must be immune to protect the population. C, emphasizes that everyone must be immune to protect the population. D, describes how groupthink can dominate anti-vaccine choices. E, all of the above. What is herd immunity? Is it A, demonstrates the importance of immunizing livestock? B, emphasizing that not everyone must be immune to protect the population? C, emphasizes that everyone must be immune to protect the population? D, describes how groupthink can dominate anti-vaccine choices? E, all of the above. Herd immunity. What's your answers, ladies and gentlemen? Peace, peace. If you're just now joining us, we're at our multiple choice question. We got some viewers. Ramsey, I'm gonna tell you right now, you wrong. Please like the show, share the show. At least like it. One more time, we answering herd immunity. What is herd immunity? Is it A, that it demonstrates the importance of immunizing livestock? B, emphasizes not everyone must be immune to protect the population? C, emphasizes that everyone must be immune to protect the population? D, describes how group think can dominate anti-vaccine choices? E, all of the above. Pink Magic, I'm gonna say you wrong. So Ramza and Pink Magic, I'm eliminating y'all answers. Nunu, where you at? Sutek, where you at? Rico, I know you listening in. Rasta, I know you listening in. Where you at? West Africa, where you at? Cedric, you can't answer. Teddy was good. Dave B was good. Keenan was good. Where them answers at? Everything, what up? Tika says C. Tika, you staying right there? Black African power, brother. Thank you, Cedric, for erasing your answer. Nunu, what you mean you don't know? Can we get a couple of more answers? Couple of more answers. So herd immunity is herd immunity. Herd immunity demonstrates the importance of immunizing livestock. A, B, emphasizes not everyone must be immune to protect the population. C, emphasizes that everyone must be immune to protect the population. D, describes how groupthink can dominate anti-vaccine choices. E, all of the above. I read it again. Oh, okay, you're catching up. Also, let me try this too. Let's see how that is. Let's see if they give y'all a little bit more on the YouTube side. Herd immunity demonstrates the importance of immunizing livestock. That's A. B, emphasizes not everyone must be immune to protect the population. C, emphasizes that everyone must be immune to protect the population. D, describes how groupthink can dominate anti-vax choices. E, all of the above. Everything said he walking the plank with B. All right, let's see what the answer is.
Of immunizing livestock. B emphasizes that not everyone must be immune to protect the population. C emphasizes that everyone must be immune to protect the population. D describes how groupthink can dominate anti-vaccine choices. All of the above. You know, I have to say, I lecture medical students, right? And whenever I mention herd immunity, a few people moo. Almost all of you got number two. Not everyone must be immune. That's correct. I'm glad no one picked A. That's a good sign.
Yeah. So when I go back and look, a lot of y'all knew that it was B. Why? Because you've been listening to Science with Shawn. And I'm glad that Tika, you removed your answer because that was important. From West Africa, I don't know where you got C at. Remember, herd immunity emphasizes that not everyone must be immune to protect the population. Remember, when we went 2 slides back, we talked about 80 to 85% of the population had to be vaccinated when it came to smallpox, 90 to 93% of the population when it was measles. You know, herd immunity, they want to keep that number above a plus over 70-something% of the population because The reason being is because if you don't have a certain amount of the population vaccinated, the virus will mutate and it will continue to live. It will continue to have a place to live because it needs a host. Remember, we are host to viruses, and this infectious virus will break us down. All right, let's go.
Everyone must be immune is the opposite, right? So two kinds of vaccines, active and passive. An active vaccine, we put a modified form of the pathogen or a piece of it into you, and that induces an immune response in you, and that gives you memory, so it has long-term protection. A passive vaccine, we give you the products of the immune response. So in theory, this could be antibodies or immune cells. The only passive vaccines that we use are antibody-based vaccines, like the rabies passive vaccine. It's immunoglobulin harvested from people who have been vaccinated with rabies vaccine. So if you get bitten by a rabid animal, you have actually about 2 weeks, depending on where the bite is, before the virus gets into your brain and kills you. So you can be vaccinated in that time. But before they do, they actually inject you with rabies immune antibodies. Of course, these don't last forever. They give you short-term protection. But they're useful also in other cases as well, as we'll see. So your mother gives you some antibodies during your gestation. We call this a natural passive vaccines. The antibodies are transferred across the placenta. So here is a fraction of adult values of these antibodies. With time here, we have conception, we have birth, and you can see the red is the maternal antibody, maternal IgG. At birth, you have a lot. So you have her immune experience. Reason is because your immune system doesn't develop until maybe 9 months. Makes low affinity IgM first, but the IgG and A come later as the maternal antibodies decline. So that's a passive vaccine. The baby's immune system ramps up, and then the baby can make their own. I like this story of Lassa fever. This is Nurse Pinio. She was working in Nigeria, and she got Lassa fever in the 60s. She was brought back to Columbia Presbyterian Hospital, and she recovered. Meanwhile, this guy, Jordi Casals, he's a virologist working at Yale. He was working on the virus, and he infected himself. So they brought him to Columbia, and because he lived in the neighborhood, and they gave him Penny Pinio's serum. It shouldn't be blood here. Actually, maybe they transfused him. I don't remember. I would guess they would give him serum, and it saved his life. We think maybe he would have recovered anyway. But that's a great story of convalescent serum. And it's been used in many other cases. And of course, there are ongoing trials now of convalescent plasma for COVID-19 patients. It's not clear to me that they actually work. Often they're given too late. You need to give these antibodies early before the virus titers are low, as we've mentioned before. Ebola virus antibodies were used in the big West African outbreak, antibodies against the spike protein of Ebola virus. And of course, now we are using monoclonal antibodies to treat COVID, made by a couple of companies. Here is Lilly's unpronounceable monoclonal antibody. They're actually different ones against different epitopes. Here is a structure of the spike receptor binding domain, which would be this green part here of the spike, and there's ACE2 bound to it. And this is one antibody binding to RBD that would interfere with attachment. Regeneron's also making these. Historically, they can be made in a couple of ways. You can make monoclonal antibodies in mice, and then you do what we call chimerization. You get rid of most of the mouse protein sequence in the antibody. You just leave the antibody combining portion or the antigen combining portion, and you replace the rest with human sequences. Otherwise, you would make an antibody response against the monoclonal and clear it really quickly. Nowadays, we can isolate B cells from patients and identify monoclonals from them that way, and they're already human, so they're beautiful, and that's how these were identified. But as I said, I'm not confident that these are making any difference. They have to be given intravenously. They're often given when you're really sick. They're trying now to give them to people who test positive and are at risk for serious disease like other comorbidities, obesity, diabetes, and other diseases. It's hard to do that. It's hard to know who's going to get sick. Anyway, so that's passive antibodies. That's all we'll talk about there. What are the requirements for an effective vaccine? Let me see. There are a couple of questions here. Why don't we vaccinate everyone for rabies? Too rare. It's too rare, and we don't want to immunize people for rare diseases. So we wait till you get bitten. And as I said, you have time to immunize people. Rabies is one of those diseases where you can be vaccinated after you're exposed to the virus. Most of the other viruses, they proceed too quickly to be able to do that. But rabies takes 2 weeks most of the time. If you're bitten on an arm or a leg, it takes 2 weeks. Now, if you're bitten on the face, that's not going to take 2 weeks to get to your brain for obvious reasons. So be careful when you kiss raccoons, okay? Because they carry rabies. Requirements for an effective vaccine. You need to make an appropriate immune response. Remember, there's Th1 versus 2 responses, CTLs versus antibody production. Most of the time, we don't know which one is more important. We mostly focus on making good antibodies, which has been the case with COVID vaccines. We measure antibodies and T cells, but mostly we do neutralization assays and say, yeah, the antibodies are good. And we never do functional T cell assays. So you need to do an appropriate response. It mostly says we give people the vaccine. We'll see if they make antibodies and T cells. We'll see if they're protected and try and make a correlation. And of course, you have to be protected against disease. Just making antibodies isn't good enough. You have to do a clinical trial where you say, does this vaccine prevent disease? You do not ask if it prevents infection, although now they're doing that for these vaccines. It's not going to prevent infection, for sure. It's going to prevent disease, though. That's how vaccines work for the most part. The vaccines have to be safe, right? Minimal side.
Let me pause it real quick because this is key. We have people on social media still arguing this point. It doesn't stop infection. It doesn't stop infection. No vaccine stops infection. It prevents disease. Let them say it again.
Antibody production. Most of the time, we don't know which one is more important. We mostly focus on making good antibodies, which has been the case with COVID vaccines. We measure antibodies and T cells, but mostly we do neutralization assays and say, yeah, the antibodies are good. And we never do functional T cell assays. So you need to do an appropriate response. It mostly says we give people the vaccine. We'll see if they make antibodies and T cells. We'll see if they're protected and try and make a correlation. And of course, you have to be protected against disease. Just making antibodies isn't good enough. You have to do a clinical trial where you say, does this vaccine prevent disease? You do not ask if it prevents infection, although now they're doing that for these vaccines. It's not going to prevent infection, for sure. It's going to prevent disease, though. That's how vaccines work for the most part. The vaccines have to be safe, right? Minimal side effects. No vaccine is 100% without side effects. Like polio vaccine can paralyze you. 1.5 million kids get paralyzed by the polio vaccine. They have to induce protective immunity in a population. It has to be long-lasting protection, although you can't plan for that. You just have to make something and hope that it lasts. It has to be cheap. WHO wants less than $1. Genetically stable if you're making infectious vaccines. Be nice if you didn't have to freeze it. That's been a big issue with COVID vaccines, right? And delivery. All the COVID vaccines pretty much are needle delivery. That's hard. Needles are expensive. You have to know how to use a needle. Not just anyone can use it. If you could deliver vaccines orally, that would be great. The polio vaccine is orally delivered, cheap and easy to do. And then there's some other approaches that we're developing that will replace the needle, I think, at some point. Anyway, this picture down here is a dewar. It's kind of a freezer. You put vaccines in with dry ice or liquid nitrogen, and you can deliver the vaccines to remote areas where there may not be freezers. WHO has helped develop those. So let's talk about different kinds of vaccines. These are all the kinds that I know of. You start with a virus. You can make an infectious vaccine that doesn't cause disease. That's called an attenuation process. We can inactivate with chemicals. We can break it up and purify non-recombinant subunits. And the modern way, we can use recombinant DNA, where we could say, take a gene of interest in the virus. For SARS-CoV-2, it's spike, of course. We could produce spike protein. That's the Novavax vaccine. We can use the DNA to make an mRNA vaccine. That's a brand new one this year. And that last year's lecture didn't have mRNA vaccine in it because they'd never been used in people. We tried DNA vaccines and they don't seem to work well in people. Or we can use vectors like adenoviruses to deliver the gene of interest. And that's, of course, happening with COVID-19 vaccines. When you produce the protein, for some viruses, depending on what protein you use, it can assemble into a capsid. That's a virus-like particle vaccine, and we have some of those as well. So I want to explore each of these with examples of them. And here's a list of vaccines licensed in the U.S. You can see them all here. Type of vaccine, attenuated, inactivated, recombinant. Most of these are traditional vaccines. Who gets them? Some vaccines are just for the military. Adenovirus vaccines just for the military. Some are for travelers. Hepatitis A, we don't immunize people in the U.S. unless you're traveling somewhere where there is Hep A. Hep B goes to everybody. Should get it. Another travel vaccine here. Universal vaccination of infants. So some of them are infants. Some of them are specific people. And then the schedule here. The COVID vaccines are not licensed. They are authorized. Pfizer, Moderna, and J&J. Pfizer, Moderna, mRNA, of course, J&J is an Ad26 vector. They are authorized. They have emergency use authorization because the phase 3 usually takes 2 years to complete it. It's been accelerated because we're in an emergency. And some people have used that as an excuse to say they're not safe, but that's not true. All the safety concerns really are addressed already. What's addressed in 2 years is the durability, not safety. It's the durability. So we don't know how long they're going to last because we haven't gone 2 years. Ebola vaccine is licensed in the US. It can be used if we ever had Ebola here, but it's used in West Africa. So an inactivated vaccine, why is adenovirus recommended for the military? Because mostly that's where you have outbreaks. You bring all these people together who've never seen each other from all parts of the country. Boom, you have big outbreaks of adenoviruses. They can get sick and then they can't be trained if they're sick, right? Then that's not what the military wants to do. So we vaccinate them. We take the virus, we inactivate it with chemicals like formalin, propiolactone, detergents. You test in the lab, make sure your virus is inactivated. And you're basically removing infectivity, but not compromising antigenicity. You have to check that, right? You do plaque assays, not PCR. You need to do plaque assays. And a great example is polio vaccine. Would the J&J vaccine be effective in someone who's received adeno? Yeah, sure. Absolutely. The J&J is an adenovirus. You mean that military adeno? It's a different vaccine. The one in the recruits is not serotype 26, which is the J&J vaccine. So there's no issue there. All right, poliomyelitis is inflammation of the gray matter. And from this 1959 textbook, A Common Acute Viral Disease, which is funny because now if you look in a textbook of medicine, you wouldn't even find it. Brief febrile illness, sore throat, headache, vomiting, often with stiffness of the neck and back. In many cases, a lower neuron paralysis develops. That would be 1 in 100 cases. This is the curve of polio in the US from 1900 to the present. You can see became epidemic in the early 1900s, as I've told you before. After World War II, all the new kids born, the baby boomers, added to the number of cases. They got infected. So we made a vaccine. Now it's been eliminated from many parts of the world. It's caused by poliovirus, of course. And in hospitals in the 30s and 40s and 50s in the US, they're full of iron lungs. We didn't have intubation machines. It's a good thing we didn't because they're bad. They can really mess you up. Putting a tube in your lung and pushing 6 liters of oxygen a minute. These are better. They breathe for you by negative pressure. You slip into these and the chamber has a membrane, a diaphragm that expands and contracts. And we don't have any more of these, but we could have used them for COVID. That would have probably saved more lives. Anyway, they're all gone because there's no more polio. And FDR, president of the US, had polio in his 20s. Couldn't walk. He needed crutches and had leg braces, and he was in a wheelchair. He raised the money to make the 2 different polio vaccines I'm going to talk to you about today. And one of them is the inactivated vaccine, which I've mentioned, developed by Jonas Salk, treated with formalin, clinical trial in 1954, paid for by money raised by Roosevelt's foundation, 1.8 million children. Can you imagine? These COVID trials are 40,000 people, right? 1.8 million children in 1954. There were no computers. We had to keep the records on index cards. I don't know. Do you guys know what an index card is? It's a small piece of paper you have to write on, and then you can't lose it because there's no backup. It's amazing that they were able to do that. The biggest clinical trial ever done, 50% protection. That's not a lot. And then it was licensed right away. And these are the headlines. Within a few months after the vaccine was released, one company, Cutter Labs, they hadn't followed the procedure for inactivation correctly, and they released vaccine with infectious virus in it. So it caused polio and was a big controversy, and that led to modern day product litigation. Anytime someone gets injured by some product, you can sue them. And the idea was established that even if they did follow the procedures, the fact that they're selling something that hurts you makes them liable. So poliovirus, you recall from our discussion in acute infections, it's acquired by fecally contaminated material you ingest. It goes into your intestine where it reproduces in the mucosa and is shed in high numbers, but in 1 in 100 people reaches the central nervous system through the blood. There's a viremia in just about everyone. And when you get inactivated polio vaccine, the antibodies in your blood will block the infection so you don't get paralysis. And we introduced the inactivated vaccine in 55. It was used until 62 and got rid of most of the polio in the US, but didn't completely eliminate it. This vaccine does not prevent infection, but that's old history. Nobody reads it. Nobody remembers it. It didn't. It prevents disease, and that's all we cared about. No more paralyzed kids. We don't really care that the virus is still circulating. Another inactivated vaccine, influenza virus. Influenza virus, of course, enveloped viruses with segmented genomes, spikes in the membrane, hemagglutinin and neuraminidase. And there are 3 types of flu. We vaccinate against A and B. And we have an inactivated vaccine because flu can cause up to 50,000 deaths a year in the US. Every year, 3 to 50,000 deaths. So we grow the virus in chicken eggs. We formally inactivate it or disrupt it. Make a lot of vaccine every year. A lot of chicken eggs go to this manufacturer. Actually, when you get a flu vaccine, it's about 1 egg's worth of virus. And it's about 60% effective in kids and adults less than 65. It's much less effective in older people, and part of the reasons are that there's no good memory, and they probably need more antigen. So now there's a high dose vaccine for them. I joke that when I get my flu vaccine, I get the old person vaccine, I get the high dose. And protection correlates with antibodies against the 2 surface proteins. Now we can make them in cell culture, so we don't have to use just eggs, but the eggs are much more efficient. The problem with flu vaccines are the envelope proteins change each year, and we need to make new strains that we select in the first few months. So this is not a big deal to change the vaccine every year. People are freaking out with COVID vaccines. Oh my gosh, we're going to have to make a new vaccine every few years. Just read the literature, folks, and learn what's been done. And to make these vaccines, we make reassortants. We have a high-yielding strain that grows really well in eggs, and we swap out all the genes except the HA and the NA, and that is for the currently circulating strain. So this is what you would get if you got a flu vaccine this year. It has an H1N1 subtype, it has an H3N2, and it has 2B viruses, and these just changed this year compared to last year. So there's a quadrivalent vaccine, 4 different viruses to protect you against the 2 circulating A viruses and the 2 circulating B viruses. Would a person who gets flu vaccine every year have a greater overall immunity compared to a person who got their flu vaccine for the first time that year? For influenza, the very first virus you see tends to predominate your memory. So if you were infected in 1918 with H1N1 and you survived, and then in 1968 you got H3N2, you would make a lot of H1N1 antibodies and less against H3N2. That's called original antigenic sin, by the way. Very colorful name for it. And we're trying to get around that. So this is the process for selecting a flu vaccine. I had an expert on TWIV about talking about this. But basically, WHO does surveillance globally to find out if they can predict what strains are going to be circulating in the next season. In January, they select the strains, they prepare the high-yielding reassortants, they make the vaccine, and they do some testing. very limited testing, packaged, and then at the end of August they can start vaccinating people. And then the flu season begins in October-ish. But for older people, you go in August to get your flu vaccine at CVS or Rite Aid. By February, your immunity is waned and you can get infected. It's a real issue. And the other issue, of course, is that the virus drifts antigenically. Single amino acid changes in these epitopes. This is the flu hemagglutinin. And these colored epitopes are where individual antibodies bind. Single amino acid changes can reduce their ability to prevent disease. So we have to keep an eye on the changes that go on and make a decision. Some years we get it right. We match the vaccine with the circulating strains. And other years we do not. And there's more disease that year. Which statement about inactivated vaccines is incorrect?
Okay, hold up. So, which statement about inactivated viral vaccines is incorrect? Chemicals can be used to inactivate infectivity, which is A. B, they do not replicate. C, they can be dangerous if inactivation is not complete. D, antigenic variations can make them ineffective. E, none of the above are correct. So, which statement about inactivated viral vaccines is incorrect? A, chemicals can be used to inactivate infectivity. B, they do not replicate. C, they can be dangerous if inactivation is not complete. D, antigenic variations can make them ineffective. E, none of the above. I'm going to read it one more time. Which statement about inactivated viral vaccines is correct? A, chemicals can be used to inactivate infectivity. B, they do not replicate. C, they can be dangerous if inactivation is not complete. D, antigenic variations can make them ineffective. E, none of the above are correct. Which statement about inactivated viral vaccines is incorrect? A, chemicals can be used to inactivate infectivity. B, they do not replicate. C, they can be dangerous if inactivation is not complete. D, antigenic variations can make them ineffective. E, none of the above are incorrect. Ramsey retracted his comment. This is guesswork time. B. Nunu says D. 220 Love. Hey, what's going on? You popped up out of nowhere. You must have just joined us late. She said E. Look like somebody was waiting on that. She said she's stuck on D and E. One more time. Which statement about inactivated viral vaccines is incorrect? A, chemicals can be used to inactivate infectivity. B, they do not replicate. C, they can be dangerous if inactivation is not complete. D, antigenic variations can make them ineffective. E, none of the above are incorrect. Waiting on a few more answers. Just a few more answers. One more time. Final try. Come on, y'all. We got people watching. Which statement about inactivated viral vaccines is incorrect? Is A incorrect? Chemicals can be used to inactivate infectivity. B, they do not replicate. Is that incorrect? C, they can be dangerous if inactivation is not complete. Is that incorrect? D, is antigenic variations can make them ineffective. Is that incorrect? E, none of the above are incorrect. This is about which one of these are incorrect. So if you're trying to change your answer up, now's the time. I'm going to give you like 30 seconds because I know there's a delay. Yeah, everything that is incorrect. Not correct. That is incorrect. Antigenic variations can make them ineffective. You sure that's incorrect? Tika says A or B. Some guesswork going on. Cedric cheating. He trying to help y'all. And I know he over there laughing. He trying to help y'all. Trust the answer. I'm going to read it one more time. It says, which statement about inactivated viral vaccines is incorrect? A, chemicals can be used to inactivate infectivity. B, they do not replicate. C, they can be dangerous if inactivation is not complete. D, antigenic variations can make them ineffective. E, none of the above are correct. I love when we get these little quizzes.
Chemicals can be used. They do not replicate. They can be dangerous if inactivation is not complete. Antigenic variation can make them ineffective.
Hold up. So before he read the last one, I want to know your answer. Okay, here we go. We finna learn something right here if y'all didn't know, but the answer is easy.
None of the above are incorrect. Why are RNA segments from only high yielding included? Because they allow the vaccine to grow really well in eggs. If you take a clinical isolate and try and grow it in eggs, you're not going to get enough to make a vaccine. So you take the HA and the NA, and those are the important proteins for antibody neutralization, and you reassort them into a strain that grows really well. So none of them are incorrect. Chemicals can be used to inactivate.
All right, the answer is E. None of the answers above was incorrect because you're dealing with inactivated viral vaccines. Remember, you have two different type of vaccines, right? He talked about the inactivated viral vaccine. That's where you take the dead strand, right? So what happens is you have to weaken the live virus. You have to weaken it or deactivate it, right? So it has to be inactivated. Now, chemicals can be used to inactivate its infectivity, and they do not replicate, and they can be dangerous if inactivation is not complete. So if you don't complete the inactivation, it can be dangerous. Remember, we had a huge mishap happen. I believe it was 1960. It was either the 1940s or 1960s. My mind's slipping me right now because I'm in another thought, where they were administering a vaccine, and lo and behold, they inject. I think it was it polio. It was the polio vaccine. Remember the incident with the polio vaccine, where the stupid people, well, they weren't stupid people, but the people had administered the wrong vials, and it had the live polio virus in it. And then they went and stopped it from being administered, and they recalled all of those vaccines that were produced. They recalled all of that, and then they administered the right, they got the right vaccines out. Remember that with the polio? That was alive. Yeah, see? Yeah, see? Man, I be thinking too much. But yeah, I knew it was either the 60s or 40s. I knew it was a even number. So I was right. 1960s. I should have stuck with my first one. 1960s polio. Yep. On it. So yeah, you had that. So in this instance, they inactivated that virus and dumbed it down, and it takes all of these things to go into effect. Now, as you can see, only 75% of the people in his class, which is a classroom full of people who are actually trying to study to be professionals at this level, got that answer correct. So we need to know that none of the above are incorrect. All right. So what I'm gonna do here, man, is let me see what his next one is. His next one is, what are some requirements for an effective vaccine? So I don't even have to play the other slides, but I'm gonna go ahead and I'm gonna ask this question. What are some requirements for an effective vaccine? Low cost, ease of administration, provides long-lasting immunity, minimal side effects, all of the above. So I'm gonna go back. What are some requirements for an effective vaccine? Is it A, low cost, B, ease of administration, C, provides long lasting immunity, D, minimal side effects, E, all of the above? Juju then showed up and put her answer in the chat real quick. So, what are some requirements for an effective vaccine? Is it low cost, A, B, ease of administration, C, provides long lasting immunity, D, minimal side effects, E, all of the above? One more time for all the people. What are some requirements for an effective vaccine? Is it A, low cost, B, ease of administration, C, provides long lasting immunity, D, minimal side effects, E, all of the above? Come on now, I'm waiting on some answers. Quit texting y'all booze and everybody and give me some answers. What are some requirements for an effective vaccine? Is it A, low cost, B, ease of administration, C, provides long lasting immunity, D, minimal side effects, E, all the above? I know there's a delay, so I'm gonna wait a little bit. All right, I got that article. One more time. What are some requirements for an effective vaccine? A, low cost. B, ease of administration. C, provides long-lasting immunity. D, minimal side effects. E, all the above. What up, Marlon? Peace to you, bro. I know what y'all doing. It's late night. I know what y'all doing. You're distracted. The devil is up on you. Everything said his house money is on. Come on, y'all. I'm gonna read it one more time. Waiting on 220. Unless she already answered. Oh yeah, she answered already. You can continue as you were. All right, one more time. What are some requirements for an effective vaccine? A, low cost. B, ease of administration. C, provides long-lasting immunity. D, minimal side effects. E, all the above. As said, you said, focus, Daniel, son. Facts. Ramza, they have not. They what name a vaccine that they weaponized? Yeah, you was first with E. My bad. I see that. I went back. Well, after Julanda. Julanda just came in and threw an answer in there and then kind of dipped out. And everything is everything. I went back up. All right, I'm gonna go ahead and give y'all the answer.
Low cost, ease of administration, provides long lasting immunity, minimal side effects, all of the above. 100%, all of the above. You got it. Good job. All right.
Good job. All of the above. Good job. All right, so good job by everybody who hung in there with me, answered a couple of questions, proceeded and moved forward. Nah, Shawn's not tripping, Ramza. Shawn's a realist. Shawn's not a pseudoscientist. He's not a conspiracist. I deal with reality. What do we have evidence for? We knew what happened in Tuskegee. Tuskegee, they failed to treat the people who had syphilis. They just failed to treat them when they had a cure or they had the treatment available. They just watched them, but they did that to their own as well. They have done some shrewd things scientifically in the past, but we don't have to go all Rizza Islam over here. You feel me? We ain't gotta go there. Nah, well, no. They have never administered a vaccine that has made us sterile. Never administered a vaccine that made us sterile. Ever. Nah, bro, you tripping. HIV. See, you tripping. See, you tripping. Ramsey, you gonna get beat up, bro. You better stay up out of there. Facts. That is correct. That is correct. But 220, you know what we did? We did a whole show on the Tuskegee experiment, and I left some good sources for anyone that we may run into, and it's on this channel. So let's do this real quick, and I'm gonna go back to it. I'm gonna share my screen again, and this is this is for people who, you know, who want that information. So like when people bring up Tuskegee, boy, Kofi got us subscribed to this pseudo dude right here. Man, I don't even know how Kofi tripping, dog. I don't know who did that subscription. Why is we subscribed to a pseudo? Just want a headache. Do 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 do. Just bear with me, y'all. I'm trying to. Here you go, right here, right here on the Mossy. Oops. But the most important part of this on the Mossy is the fact that there's a sources here that are very, very, very useful for the educational purposes of anyone who is unfamiliar. Anyone that's unfamiliar. Okay, so we have it here. You know, we dealt with it. We went through several documents, as you can see on the screen. You know, we even listened to the black doctors regarding the Tuskegee experiment. We got back to the Tuskegee experiment. We did a multitude of things in this conversation, and we even had a further conversation with a brother around the hour 53. So the first portion of this whole entire bill, because I think this is where I ended with this. I ended over here somewhere. Yeah, we end over here. So the first little hour and some change, all Tuskegee. And hopefully, if anyone is interested in actually sharing that, you can go on the Massa Warrior Clan, look up the Tuskegee experiment, and you can share that with people. So it's all right. We still working on Ramsey. He got a long way to go. I think you sort of on the COVID joint, but still, though, I think you're being paid. Did you mean solid? Yeah, Cedric is he's in the field, bro. He knows all about what's going on with the vaccine, so it's kind of tough to argue with him because he's credentialed. He's of the field. He's of the field, so you know it would take some work to actually get around what he's saying. Hi, you crazy boy? He said that Mo find you a government grant. So, man, I do want to appreciate everybody for tuning in to Science with Shawn this episode. Like I said, I didn't want to just continue to do these shows as consistently as I was doing them because we've tackled a lot of the conspiracy theories. I don't know if y'all been hearing any new conspiracies. I have not really been paying attention, but it looks like science is sorting out the pseudo. So we just want to continue to promote good scholarship, good methodology, and you know, good information that would allow us to advance our people. We're going to stay on that tip. You know, when we get more available data regarding pediatrics trials and the teenagers, more data on the teenagers, and as you noticed, the doc came out and said the BLA is in sight, and the BLA could be going back toward the end of summer, or it could be sooner, because once they show that this vaccine is safe in children, Pfizer, Moderna will be filing for their BLAs, and this vaccine will be on the shelf, and I mean will be available to everyone, and they're going to continue to make you know, other things that would be supplemental for those who cannot get the vaccine. So they continue to do those testing and those trials and come up with a solution. And this is what we need, because we need to have the mindset of, you know, being prepared for the next pandemic, because it can happen at any time. We were prepared. We were preparing 4 years ago, and then we were no longer preparing because of uh, the presidency and that illegitimate reason of being uh, stupid or just not listening to the scientific field, and that caused the breakout to be what it is. Had Trump did a better job on the forefront of shutting the country down a whole lot sooner, mask mandating and social distancing, we probably would have had a great control on the lid. And then he pulled all of that stuff back, which opened up the door to more ignorance. But I'm gonna keep this bite size. We've been on here an hour and 40 minutes. This is some good, healthy building information. Hopefully, we all learn. Please, everybody that's listening to my voice right now, tune in tomorrow about maybe 12:30 Eastern or potentially 1:30 Eastern, because I got this dude coming to my crib to wash my car, and I know he gonna pull me away if I start a show. He gonna pull me away because he got to get his paper. So I think I'm gonna do tomorrow about 2 p.m. Eastern. Sutek should be up by then. He shouldn't be in the bed. But I am going to be doing a healthy bill. We're going to get into some things, and hopefully people will be able to engage in it. I'm going to present the information. Once I present the information, I'm going to provide a conclusion, and then I want to dialogue. I want to be able to further the discussion. We're not promoting anything, but we all have our opinions, and we all have our perspectives. And this ain't gonna be just me presenting something and then we closing the door on it, and then we get 10,000 comments over the video. No, we are going to target and address something specifically that is affecting people, and we're going to deal with it. We're going to deal with it. I haven't ever thought about doing this before. Nah, we ain't advocating either. We just gonna deal with something, and we're not advocating for it either. So y'all don't know what it is yet. You will know tomorrow. I am going to shock you with what I am going to deal with. I am not going to reveal the subject. The presentation is done. It is sourced up. And it's ready to go. If my manager didn't call me today and ask me to help assist another supervisor's team, I would have did it today because I would have had the time. But I ran to the money, and therefore I came with Science with Shawn once that was done. And that's why we are where we at with this particular part of the discussion and things of that nature. And I just wanted to deal with that, so I had to make the bread. Uh, Then get to it. Now, remember, also go and support our works, man. CoffeePieSideTV.com. Get our latest publications, 54 deck of quiz and educational cards, put a face with a name cards, from cocaine to consciousness, all the Spears volumes, my children's book, Kofi's children's book, One Night Before Bed, and Kalawat's Trip to the Motherland. As I learn, we all learn. From cocaine to consciousness, support us. We're trying to do the work, and we got other works coming in. And don't forget to get Killmonger's Corner, the Pan African Journal, Volume 2 of that. Don't forget to get I'm in my Ot Raz, all 5 of his publications. Just look his name up in Amazon. The Illuminations of Right, get his work. Get his work. Go look at Michael Hope. Look up Michael Hope. Get his work. Look for Nahisi's work. All of those things. Look for man, we working, y'all. So again, man, I appreciate all the support, the love, and everything. Tune in tomorrow. It's gonna get real good.
Log in to KofiPaisaTV.com and get Spears of the Mossy Volume 1 by Kofi Paisa Research Team, from Spears the Pen Volume 2 by Kofi Paisa Research Team, Spiritual Combat Volume 3 by Kofi Paisa Research Team, One Night Before Bed by Any Harret Shawn Calfunny, Kalawa's Trip to the Motherland by Kofi Paisa, From Cocaine to Consciousness by Any Harret Shawn Calfunny, As I Learned, We All Learn by Kofi Paisa. Also, if you want fresh merch, go to our online store, Family Connect Apparel, and get all the brands. Also, get our 54 deck of quiz and educational cards available now on KofiPaisaTV.com.